and you don't know how much we welcome your input on this, because I said if it's going to be successful, can't do it without the person on the ground that deals every day with the patient and how to best meet those needs. I'll give you a real quick example of something, and I don't know how we get past this other than we're going to set some minimum standards and such so that when you do make that investment, you're getting something that basically is understood by everybody. Interoperability, that's a given, and so on. But I have a small application software vendor in San Antonio. She's absolutely brilliant. She's wonderful and made quite an investment. So I go and I get briefed by what she has to offer the medical profession in San Antonio. I go to my cardiologist and I'm sitting there, and his wife is the office manager. So I just said, where did you purchase your electronic medical records? And they tell me about this big, giant national firm. So I said, well, do you know about so-and-so who's here locally? And she's the local leader and everything else. So, yeah, and they had made their presentation. They considered it. So I asked the office manager, who's the real boss, the wife, and I asked her, why didn't y'all buy that system? She said, well, because my husband, the cardiologist, wanted something with all the bells and whistles. I said, but did the local vendor, what they offered, did it meet the needs? And she said, yeah, we don't really use all the bells and whistles that my husband wanted, but that's the way he is about cars too. So I'm just saying that I think there's some basic systems out there, and I know they need special tweaking because a cardiologist, just like a neurologist, is going to be different from the family practitioner and so on, but I think that it's out there. The question that I have is, how are you making your voices heard? Each of you that's in a specialty obviously has an organization or an association. Are they coming together in identifying the special needs of your specialty and making sure that that is being reflected? Now, I don't know. Look, the American Medical Association is engaged, don't get me wrong, and that's the big umbrella. But I'm just talking about something that Dr. Talley's made reference to a couple of times, and that is again, tailoring things to make sure that they meet your needs. So I'll just quickly, if you'll tell me what efforts are being made within your own specialty, with your own group, within your own association, to be able to communicate your special needs.
Well, as you said, every specialty is different, and somewhat based on size. The American Association of Family Practice has done a fabulous job. They have a very intense IT department that's done a great job of promoting them, and I'm strongly in favor of that, because that is where you, the congressman and the government, needs to work. It's primary care. People like me, we're 1% of the physicians. Getting us up and running is a challenge for our association, and we have our own internal committees, and as you've seen, I'm also working with the AMA for this. But the bulk, if you can get anything to do 90% of the work, our challenge is to get 90% of the people who give 90% of the care, and that involves family practice, OB, pediatrics. The rest of us will come along in large. So the time and the effort to be spent by Congress, vendors, associations is where the vast majority of health care is being given, just like for the areas where we spend most of our money, Medicare, CHF, MI, diabetes, pneumonia. That is where the bulk of the savings has to come, and that's where HIT will do its greatest benefit.
Okay. Good point.
At the American Psychiatric Association, we have a committee of members specifically focused on electronic health records. They're early adopters who have picked this up now. And part of what they do is articulate some of the needs that they have for software in their various psychiatric practices. And this information is made available to members on the website and in other forums. And we actually have members who have adopted software. They have an opportunity to share their experiences with software on the website so that members can learn from other psychiatrists who have already adopted the systems. That's some of the activity at the APA.
The American Academy of Pediatrics has many policy statements, position papers on what we need. We're not talking about pie-in-the-sky stuff. We have specific issues that can be dealt with. We're such a small part of what the vendors consider to be their primary market, that they have a real interest in not listening to us sometimes. We're required in the state of Georgia to report immunizations to the immunization registry. I was on a committee with the State American Academy of Pediatrics, going to the vendors one by one, and them telling us, yes, we'll do this, we'll, give us yet another $100,000 per practice for just to integrate your EHR or your practice management system into that, and we'll be glad to think about it in the next iteration of the software. We have things that we can offer. It's out there. I'd be glad to present it.
Thank you.
I'm fortunate at the American College of Obstetricians and Gynecologists. I'm the one that makes the decision that has where we're going and work. And our executive board has given me as one of our top priorities to have electronic medical records and to have all of our fellows using the electronic health record. At our annual clinical meeting, we now bring in as many as last time was 24 different vendors and make them available to put them out there so that our fellows can't say, well, I don't have opportunities to meet with these people. We're pushing it very hard. We would like to see that by the year 2015 that every OBGYN in the country is using electronic health records.
Thank you.
I don't think we'll succeed, but that's what our goal. And unless you have a goal to reach for it, you'll never get there.
As a family doc in the trenches of primary care, as I like to say, that's where I live and work, I know how important it is to our small business. When I think back, I can't recall any edition of the American Academy of Family Physicians that hasn't had some article either encouraging us, instructing us, or putting it together guidelines to help us implement EHR into to make us realize that it is imperative that we embrace these standards. And the most important concept that is developed is that of the medical home. And for the medical home concept to work, where you see your family physician for your healthcare needs, that EMR is actually mission critical to having that come to fruition.
Thank you very much, Madam Chair.
Okay, well,